Hello and welcome to WTNB Today. I'm your host, Wendy Benton. Thank you for joining me. I've got a great show today lined up. We don't have an events calendar today, and that will be the next show, but we're going to talk about sleep studies and sleep apnea. So you do not want to miss my next guest, Miss Cindy Cochran. She is a certified clinical sleep health educator, and she will join me in the studio to talk about home studies for sleep apnea. We'll be right back after this message.
Hey there, I'm Dave Hanna, and I'm here to talk to you about my life passion, and that's mattresses and home furnishings, and how much they're gonna cost you. It's a lot.
Not again.
No,
Dave,
no,
I told
no,
you.
I-
I told
no,
you.
no.
No more.
I'll become you!
I'm tired of this. Hey, I'm Brent Winters, and I'm here to talk to you about my lifelong passion, affordable mattresses and home furnishings. At Mattress and Furniture Expo, we've got you covered. From brand name to brand name, and even more brand names. We've got a wide variety of brand names to cover all the price points you want to hit. And you don't have to deal with Dave trying to take all your money. Here at the Mattress and Furniture Expo, our prices are so comfortable, they'll put you to sleep. But in a good way, of course.
Relics Antiques and Vintage Decor offers a very unique blend of furniture and accessories. Come to our location today and sample the diverse exhibition of antiques at Relics Antiques and Vintage Decor.
My name is Hannah Davis, and I am the founder of the Body by Hannah fitness brand. I'm able to meet a client where he or she is fitness level-wise and really help them grow and take them to the next level.
My name is Preston West, owner of Keystone Solutions. We specialize in helping small businesses with their IT needs. We want to be the person that you call and the person that you think of first.
I believe that whatever we're facing, whatever difficulties, whatever challenges, whatever obstacles, that this word speaks to that. If you simply just have this word and you read this word and you allow it to sink into your heart, God will speak to you.
Right now at Cameron Company Medical Equipment, take $200 off the price of a lift chair or power mobility scooter. And don't miss the chance to save $500 off the price of an installed stair lift. Happening right now at Cameron Company Medical Equipment. For a limited time only, Cameron Company Medical Equipment is offering free delivery on select specials. For more information, call 423-614-5962. Cameron Company Medical Equipment, where we make medical equipment affordable.
People ask,
how did we make it to the top of a Marco's Pizza?
it is the harmony of our flavors.
100% real cheese.
Together, we bring authentic Italian pizza
to America.
Our ingredients speak for themselves. Marco's, authentic Italian pizza.
Welcome back. I want to introduce you to Cindy Cochran. And Cindy, welcome to the show.
Thank you.
You are a certified clinical sleep health educator. I had to look at my notes because that's such a long title. And I'm sure people are going to be so interested in our topic today because you're talking about sleep apnea and testing for sleep apnea, but you do it in a very convenient way.
Yes.
Well, before we get started about what you do and going into the homes, tell us a little bit about you.
Well, I moved here from Alabama in 2001 to Knoxville and started a lab at Children's Hospital. And then I became a grandmother and needed to go to days. And there was a day spot coming open at Sky Ridge for a sleep coordinator. And I took that position until just recently. In February, I left Sky Ridge and the opportunity come open to go to work with Dr. Bacha doing home sleep studies.
Okay. And I know this sleep studies have been around for a few years. I say a few years, maybe several years. I don't actually know when they started because people started having trouble sleeping. And in that, I guess doctors found that it had to do with their breathing.
Yes.
And Dr. Bacha, what does he do?
He is a pulmonologist here with Blue Ridge Pulmonology, and he is also board-certified sleep physician. And Dr. Jaggers is board-certified sleep as well.
Okay. And then you actually you've done sleep studies or been involved in that
I have
field.
been doing sleep medicine since 1997.
Okay.
Yeah.
A long time.
And I become a registered sleep tech in 2001.
And now, why have things changed? Because this is what you're talking about today are the home studies now.
Yes.
And there's been a big push for that from insurance companies. And why has that come about?
The main reason the insurance companies are pushing for it due to patient compliance. The patients, they have their sleep study, but then no one's actually explaining what's going on with them. They get a CPAP machine to breathe with, and from there, then they're just lost. They're falling through the cracks. And that's where I'm stepping in. I'll be going to their house, working with them, making them comfortable. I mean, it's a scary situation when you know obstructive sleep apnea kills or the damage it does to your heart. So I'm going out working with them so that they will stay compliant with their machines, wearing the breathing machine, explaining to them this is what you have, but there is treatment. We can help you.
Right. And typically people have gone into labs, like we were
Yes.
talking before we came on the air, that you're actually hooked up, and of course they're testing for more things, as you had mentioned, in a lab situation. But if it's just sleep apnea that they need to be tested for, they're able to do it in the comfort of their home.
Yes, in the sleep lab, there's actually 101 sleep disorders that you can look for. The home testing is strictly obstructed sleep apnea is what we're looking for. And that is 90 to 95% of what most people do suffer from.
Okay. And if you can actually tell if it's something more than sleep apnea, correct?
With the home sleep study, we can just strictly diagnose sleep apnea. If we don't see sleep apnea, there are other tests that the sleep physician can order in lab studies.
Okay, and then you
yeah.
would send them on to the
To a
physician
yeah.
to go to a lab.
Yes.
Which is makes sense, and because of that, they've pushed this new, I guess, process in this field.
Yes.
To have more of the home studies. And you were telling me too, how many sleep health educators are there?
The first exam was offered in May of 2014, and as of date, there's 121 of us worldwide that are certified. Now, there's a lot of sleep educators, but to actually have took the exam through the Board of Registered Polysomnography, there's only 121 of us who have passed.
Okay, so
I'm number 14.
Okay,
Yeah.
that's great. Congratulations. And you want a board certified
Yes.
educator, I'm sure, looking at your results. So you go in, and then we're going to talk a little bit in the next segment exactly what you do with the machine and teaching people how to use it. But in that process, you're more of that hands-on person.
Yes, yes, because they don't understand the technical terms that most physician offices use. So when I go to their home, I can sit down with them, explain this in the order that they can understand it. Just put it in layman's term where we can understand it.
Right. And
because it's scary. I mean, a lot of people have died from sleep apnea. And there's like 30% walking around, 30% of America that's undiagnosed, that just refuse it. And most people actually get diagnosed because their spouse actually throws a fit until they go get tested due to their snoring or witnessing the apnea and doing private video of them
Yes.
to prove to them. I'm not going to mention my husband, but yeah.
Well, I know my parents both actually went and had the sleep test done in the lab, and it was so, I guess it was unpersonal. You're
Yes.
trying your best to sleep, and it's more than one visit that you have to go through. And the cost, you were talking about the cost as
Yes.
well, is there's such a difference.
Yes, the home sleep study with the interpretation is $350. If the test messes up and we don't use it, we're not going to charge you again. It's one time $350, even if we have to do it 3 nights in a row. At the in-lab test, you can go in, it's $6,000 to $8,000. You can have what they call first night effect. You're still going to be charged for that, and that's where you're nervous and you don't show apnea. Then you come back a few weeks later and you show it and you're paying for that test, and then you come back for a CPAP titration and you're paying for that test. With this, when we go to your home, you're sleeping in your bed, you're sleeping your normal hours, which we all know in labs you have to have 6.5 hours recording, and they may get you up at 5 o'clock in the morning because they've got enough recording time, and they're missing the most important. And I can't stress that enough. If they're getting you up at 5 o'clock, you're missing the most important part of your sleep study, because between 4 and 6 a.m. is when people's sleep apnea is the worst.
Wow.
And so my patients at home, they're putting it on when they would normally go to bed, and it may be, they may wear 8, 9, 10 hours, and then when they get up, they take it off. And so I have their entire night.
Okay. Cindy, let's take a quick break, and when we come back, you actually have some slides of tests that are normal and then not normal, and we can kind of go through that, as well as your machine that you leave with those people who potentially have sleep apnea. We'll be right back after this break.
I'm Tony Sism, sales manager at Kyle Motors. Come by and pick out your SUV, truck, or car today. If we don't have it, we'll get it for you. Come by at 802 20th Street, Southeast Cleveland, Tennessee, 1 block from Bothbauer School, 1 block from Dalton Pike. I'm Tony Sism, sales manager of Kyle Motors, home of the $5,000 car.
For over 25 years, Ed Jacobs & Associates has been treating each of our clients like business partners. Finding the right insurance for your employees shouldn't be that complicated or expensive. Receiving quality financial advice for you and your business should be even easier. We treat each client with respect and integrity and handle your situation as if it was our own. Call me today for your own free consultation.
I don't even know how to put this announcement into words, so I'm gonna try to give you guys a picture. All right, bear with me. All right, so we've got a beginning, and we're canceled. All right. Well, when's the last episode?
was having pain in my upper back and in my neck area, which was really more of a chronic pain that I've dealt with for a year or two. My husband recommended that I come to Tennessee Valley Bone and Joint, and I saw Dr. Matt McCartney. In a very short time, I was able to get relief in both my lower back and my upper back. I walked in with pain, and the pain was almost completely gone when I walked out of his office. I would highly recommend the physicians at Tennessee Valley Bone and Joint. I'm very happy with the results.
I was having trouble sleeping at night. I couldn't be comfortable on my right shoulder or my left shoulder. I came to Dr. Palmer, and the x-rays showed I did have 2 bone spurs. The surgery that Dr. Palmer did for me was a reverse ball and joint of the right shoulder. I can wave in the air and reach behind me, do all the things I need to do now. So I'm so thrilled to have Dr. Palmer in my life and the surgery that he did for me.
I'm talking with Cindy Cochran. She is a sleep health educator, and she's talking to us about sleep apnea. And if you've ever had those lab tests done for sleep studies, you know exactly what we're talking about. And she is now offering, with Dr. Basha in town, home studies as opposed to having to go to the lab for your sleep studies. Yes. Cindy, tell us how someone, if you are diagnosed or your doctor thinks you may have sleep apnea or problems breathing at night, or that's an issue, or even if an individual thinks that, hey, something's not right as I sleep, how do they go about starting this process?
They can contact Dr. Botch's office and set up an appointment. It's about a 15-minute appointment for a sleep assessment, if that's a self-referral. And then the doctor, if their doctor wants to refer them, all they have to do is fax an order over, and then we get it from there.
So very easy.
Very easy, very easy. And the cost of it is $350. That's for the test and the interpretation.
Okay, and so once they get the referral, then they call you, or Dr. Botcha has you call the patient and set up an appointment?
Yes, I call them and find out when they want to do it, and then I go to their house and I spend about 45 minutes with them, filling out a sleep history and going over the test with them, all the equipment, making sure they feel comfortable.
Okay, and if you don't care to show the audience what exactly they have to do.
All right. This is the size of a home sleep study. This is what the case is like. And this is the little monitor that we use, and everything's plugged into it. All you have is your pulse ox that goes on this finger. Then you have this belt. It goes around your rib cage right here.
Okay.
We don't have the EEG wires. We're not reading the brain waves. We cannot actually tell when you're asleep. The scoring of it is based on oxygen desaturations. That's what the insurance requires.
Okay.
And then this is the breathing cannula that monitors your mouth and nose breathing.
Okay.
And then you put all of them on, and you turn the machine on, you put it in this little pouch, and you wear it all night long. And the next day you take it off.
Okay.
That's how simple it is.
And you just go to bed at your normal hour.
Everything is as normal as possible. You're in your own bed. You take all your medicines. If you're on oxygen, we ask you not wear it that night because we don't want to get a false reading. Or if you're on CPAP already, insurance requires most people have to be reevaluated 3 to 5 years.
Okay.
So the home study is really great for the reevaluation.
Okay. And so they would just hook themselves up. And then you were also talking about the difference as opposed to a lab study because they wake you up so early.
Yes. Yes.
I'm sorry.
The worst part of sleep apnea happens in the last third of the night. Insurance requires the in-lab studies have 6.5 hours recorded time, not sleep time. A lot of labs at the end of 6.5 hours are getting the patients up and sending them home, and they're missing the worst part of their apnea.
Okay. And you've got some slides that you brought with you that shows what that you test for. So you take this back with you, and then how do you monitor it? Do you put it into a computer
I
program?
scan it. That's what the little extra wire's for. I always have to tell everybody, don't worry about this. This is what I get the most phone calls for. They'll say that black wire's hanging. This goes to my computer.
Okay.
And I download it to the computer, and then I score it, and I have to use a protocol that the insurance companies ask. Medicare says you have to have a 4% DSAT, and all other insurance says that you have a 3% DSAT. Where it says the obstructive apnea there, that's where that person is not breathing at all. And as you can see, their oxygen at the top has went from 97 down to 86 with that, where they're not breathing.
Okay.
And with the heart rate, where it goes from 61, and see how it's affecting the heart, because the heart rates went down to 53. And then as they start breathing, it starts working its way back up.
Okay.
And, I mean, there's a 24-hour day, so if 8 hours is spent in the bed and 8 hours looks like that, then that explains why you're tired, you don't want to do nothing. The obesity rate's growing because you're just sitting in chairs. And that's why people with type 2 diabetes, is now mandatory that they have a sleep study.
Okay, so that was an abnormal test.
That was very abnormal.
And this is also an abnormal.
Yes, this is, and this person's oxygen's going down into the 70s. Even they start at 96 and go down to 97, and it's clear-cut obstructed apnea.
Okay. Okay, and then when you get this, do you take this back to the patient to show them, or do they have to see Dr. Bacha?
They will see Dr. Bacha.
Okay.
But if it's going to be a long time out, we'll go ahead and get them set up with the CPAP. The DME company explains to them. I talk to them. You know, that way they're not waiting 6 to 10 weeks of a person like that. Could be the matter of life and death. I mean, the oxygen was down in the 70s.
Yes. And so this that we're looking at is a normal.
That's normal. I'm not sure what time of the night that is. It's the exact same person. So some people have what we call REM-related sleep disordered breathing. When they're dreaming, it's like every hour and a half they'll go through those spells where they stop breathing and their oxygens are hitting the 70s, 60s. And then the rest of the night they'll breathe normal.
Okay, and if you see something like this, say you get a normal test that comes up on this person who's having trouble sleeping, and they just can't sleep, what does that tell you?
There's still some other things going on, especially with women. Right now we're finding a lot of women with insomnia. There are other tests that we can do, which we've got an actigraph, which is an actigraph. It's a little watch that you wear for 2 weeks, and you fill out a 2-week sleep diary that goes along with it. And you may see where they fell asleep, you know, it tells us when you're being really still. Basically, you've fallen asleep. And they may sleep 20 or 30 minutes, so yeah, that's their power nap. So the next 4 hours, they're not going to go to sleep. And there's so many circadian disorders and the advanced sleep stage and the delayed sleep phase and stuff like that. And we can use the actigraph for that, or they can send them for an in-lab test to look for the other 100 disorders. And Dr. Bacha is the one that would do all of that.
Okay, and it's just so convenient, though, and again, because sleep apnea seems to be so prevalent of a diagnosis these days, that this is such a great way and great opportunity for people to do it in their own homes. And the cost is, there's such a vast difference in the cost of this, and so I'm sure insurance companies are thankful that this
yes,
test
a lot
has
of
come out.
insurance companies are pushing for the home sleep study versus the in-lab studies now.
Okay, and then on top of this, once they're diagnosed, yes, sleep apnea, then a CPAP machine is prescribed.
Yes, and a lot of the CPAP machines are going to be auto-PAP, which is where they'll the DME company will come out, set them up with the machine for 2 weeks, and see they'll set it like at a high pressure and a low pressure. And what we do is in 2 weeks we download it and see what pressure they used for the most part of the night, and that would be the pressure we would give them. There again, that keeps them from having to go back into the lab for the expensive CPAP test. And then from there, I'll just stay in touch with them 3 or 4 times throughout the year to see if they're having any problems, or they can call me if they're having any problems. And just to make sure they understand what's going on and how, you know, it's a lifestyle change, but it is something that they can live with.
Right, right. And that's good that they have that personal touch with you and keeping in contact, or they've got someone, they don't have to make an appointment with the doctor and go in and wait and see them in the office. And so this is so much more convenient. So maybe those people who are out there who've put this off think I need to do it, but it's so inconvenient, and
they're embarrassed to come to the hospital. It's like they know, oh, so-and-so works there, they're going to see, you know.
Exactly.
Yeah.
Well,
and when they're just dealing with me, and I'm not from here, so I don't know anyone. They don't have to worry.
Well, it just makes it so much nicer, I think. And then you were also mentioning celebrities who have suffered from sleep apnea, and it's been detrimental to them, or fatal.
Yes,
even.
Reggie White, for one. Was a football star.
Yes.
From Tennessee,
great
I
man.
think.
He was.
And one of the guys off the Deadliest Catch, he's only 33, and he just passed away with sleep apnea. And one of the band members from Grateful Dead died with sleep apnea. And
Jerry Garcia.
Jerry Garcia. Yes. And the guy that died from Sopranos is actually suspected of sleep apnea.
Okay. So it is something that can be fatal in a person's life, and so it's just so important that you know what's going on with your health and being proactive. And you can call Cindy. We actually have your information, your contact information in a graphic that they could call you, or go to your website and
have an email, or they can go straight to Dr. Bacha.
Okay.
Either one. He has an office in Ocoee at the Polk County. We have the one here in Cleveland, and we have one in Ray County in Dayton.
That's wonderful. And then you start seeing your first patients for the in-home studies.
June the 1st.
June
the 1st. Yes.
Okay. Well, again, it is so important that people are aware of what's going on with their health and to be proactive. So if you suspect sleep apnea may be your problem, or your spouse suspects that that's your problem, please give Cindy a call, or Dr. Bacha's office a call, and make sure that you take care of yourself and your health for your family's sake. Cindy, it's so good to have you today, and this is such an interesting topic, and I think very important for everyone's health out there. So thank you for joining me.
Thank you for having me.
We will see you next time on WTNB Today.
I don't even know how to put this announcement into words, so I'm gonna try to give you guys a picture. All right, bear with me. All right, so we've got a beginning, and we're canceled. All right. Well, when's the last